The Center for Traditional Medicine promotes the cross-cultural healing arts and sciences and advances social change through research, education, and clinical treatment. The Center for Traditional Medicine is an agency of the Center for World Indigenous Studies, a nonprofit 501c3 research and education organization serving Native and non-Native peoples worldwide. This video presents a 30-minute diabetes touch therapy protocol for professionals and family members. The protocol is designed to reduce stress, relieve pain, improve circulation, reduce edema, and stimulate hope for health and healing.
We're going to work to induce parasympathetic dominance, also known as deep relaxation, because with deep relaxation comes a whole balancing of the autonomic nervous system and hence digestion and glucose control. And without deep relaxation, we can't gain control over the functioning of our body. And so this treatment draws on a number of traditions of hands-on work in which we work as a conduit to channel and transfer energy between the giver and the receiver. And we're bringing it in from the energies of the cosmos. And throughout all the traditions of the world, we have this knowledge in these ways, however they may differ. They're all based in the same concept that we can move energy through our bodies and thereby affect our bodies and our minds and really bring in the spirit.
Upper body.
And this is a very gentle contact. And my hands are placed in this position with my right hand under the left, and these fingers will cross at the spine, and these four fingers will come up around the neck and contact the 10th cranial nerve, which governs relaxation in the body. And these thumbs will come at the mastoid, right at the ear bone. And so gently, I'm going to lift the head and position my hands with this cradle. And it's named as a cradle precisely because it's cradling the head, and it's very supportive and relaxing. And you may feel free to close your eyes. And we're going to breathe together. And each person who practices this has her own way of entering into a deep state. And we're going to hold this position for anywhere from 1 to 3 minutes. We're looking for a pulse, we're looking for a tingling and a warmth, and a sense of connection. When I'm ready, I'm going to just slide my hands out very gently. And I'm ready to go into the second position. In which my thumbs are going to apply pressure right on the trapezius muscle. This is the muscle where the neck and the shoulder meets. This is the muscle on yourself. You can feel it when you want to go rub it and release some of that tension after you've been sitting or carrying a heavy load. And the type of pressure that I'm using here is where I meet the resistance of her flesh. I'm not forcing anything, but I'm going right up to that edge where it might even hurt, but it feels good at the same time. And each person has her or his own level of tolerance. And that is where the art is in this work. Now tell me, how is this pressure?
That's fine.
Okay. And I'm going to apply pressure here until the tension releases. And as the tension releases, the pain will release, and I can press in a little bit more deeply. I'm letting her invite me in. I'm applying the pressure as she releases, and so with increased pressure, she does not feel it. But what she will begin to feel is a tingling or a warmth as the energy flows through her body. I'll also be looking for signs of deep relaxation. She might yawn, she might start to get a little warm and or a little wet in her hands. That all shows parasympathetic activation. Her breath will slow. And I can move my fingers out. My thumbs will come out just another thumb width, right out to where the shoulder bone meets the collarbone. One is a very simple point that you can do for your loved one as well as on yourself. And I'm going to place my fingers here right in the little notch beneath the shoulder. And I'm going to stimulate it very mildly but vigorously. Going to stimulate it and then hold. Stimulate it and hold. This is a very energizing point. It energizes heart function and circulation. And from there, I'm in a very good position to move into working underneath the collarbone, which is where all the lymphatic dams meet in order to then return the lymph towards the heart. And so very gently here, because this can be very vulnerable and very tender in this area. But by stimulating this area, you stimulate the thyroid function, and you also stimulate and open up the lymphatic flow. Many people with diabetes have poor kidney function and therefore have poor lymphatic function. And so this would be the first step in very gently stimulating the lymphatic flow. Now, of course, as with anything, if anything you do is uncomfortable or makes your receiver nervous, then just go on to the next step. And I'm applying a little bit of pressure. I'm coming underneath the collarbone and giving it just a little lift. And everything is slow and rhythmic. Everything should feel very good. And I'm going to bring it all the way out to the tips of the collarbone. Just stimulate a little bit on these points. And for the final stimulating point in this part of the body, I'm going to contact the earlobe. Traditional peoples of Africa consider the earlobe the center of vitality. Likewise, the Chinese and people of Asia who practiced acupuncture also considered this the center of vitality. It may say something about why we pierce this area and place gems to attract the solar energy. By contacting this area and giving it a nice vigorous pinch, we stimulate vitality in the body. And this again is something that we can do for ourselves. Most of these points that I'm demonstrating today you can do for yourself. And later on I'll also show you how to do it in the office place when you're sitting down. Each point can be held for approximately 1 to 3 minutes, and that depends on how long it takes the tension to release and the energy to flow. Now, how are you doing? Good. Now I'm going to proceed down to the central part of the body.
Central body.
We've stimulated a lot of energy and a lot of relaxation at the top part. We now want to make the connection between the belly and the head. And note that my right hand is in the lower part of the belly. We're moving energy up. This also gives us a good sense of how tight or tense or how flaccid the belly is. It gives us some insight into whether the person has some digestive difficulties. And because diabetes is linked to food and nutrition and digestion, we can only help someone by helping them to improve their digestive capacity. This is also deeply relaxing in case of anxiety or any kind of cramping or stomach pain. Of course, when one is stressed out, the autonomic nervous system cuts off all the digestive juices. That's why it's important not to eat when you're stressed out. So this kind of a treatment right here will help stimulate the digestive juices again. When I have felt the energy between my right and my left hand here, I'm now ready to come up and palpate. I would like to feel right at the base of the sternum. The sternum is our breastbone, and as we come down the breastbone, we come to the tip. It's called the xiphoid process. And if I move over to the left, just 1 finger width, I'm going to be right on the tip of the rib, and I'm going to apply some pressure there. Now, people with poor pancreatic function will have a little bit of tenderness there. And I'm just going to very gently apply pressure with my middle finger. It can be a little sharp, it can be a little burning, but just ask your receiver to relax into it. And breathe with her. Once it's released, I'm going to do the same thing. I'm going to come back to the center of the sternum and then about 1 finger width over right at the edge. And when you're beginning to practice these points, do ask for feedback from the receiver. You might be on it or off it by just 1/4 of an inch. And so ask for feedback. It will most likely be a little tender, particularly if you're working with someone with impaired glucose functioning. Okay, and then we can finish up this part just with a nice, gentle rocking. This is a wonderful treatment, by the way, just for children, with diabetes or without, just to give a nice rock before bed. Very soothing. And I'd like to show you some points along the fascia lata from the thigh down to the knee. These points along the middle of the thigh are all reflexing on the left side to the stomach. on the right side to the liver. And by just very gently but vigorously stimulating these points, you will stimulate stomach function, oh, is that a little tender?
Too cool.
Okay. And then on this side, liver function. People with chronic liver or stomach problems will have a great deal of tension here. This also is an area that you can stimulate for yourself. Okay. Now what I'd like to do is contact the web of the hand. And we will do whatever we do on one side, we do on the other. And the web of the hand is related to the neck and digestive processes. And so once again, we're working to stimulate metabolism, to stimulate the digestion, to enhance its functioning. And I'm going to go back up to this point I had on Amber's shoulder that was tense. And so now I'm making a connection between the new point and the thumb, which tends to be a little tender, and I'm coming back to this point to re-stimulate it and help it release even more than the first time. And we're just going to stand here and let that flow occur. Okay. Now I'm going to move down. We've made the connection along the thighs. I'd like to now move down to the feet, which were one of the most important areas when you work with someone with diabetes.
Lower body.
One of the most important areas are the feet. People with diabetes suffer from poor circulation and nerve damage that can create very serious problems that can lead to amputation. And so it's very important for self-care, but also for professional care or for family members or friends to give good stimulation to the feet. And we can do this by contacting the feet and stretching them. And also by rotating. You'll get a feel for how flexible the foot is, also by what the temperature is in terms of circulation. It's very important to massage the feet every day and to apply pressure, very gentle pressure to some of the points. And here I'll show you a few techniques and a few of the very special points. Here, right next to this bone, you can put your thumb, and if you apply some pressure right next to it, that's a reflex to the kidneys. And this will help improve kidney function and help reduce stress. And it may be a little tender to begin with, but as you hold it, it will release. And from there I can apply pressure all along the edge of the foot. And as I come up, I'd like to apply to a point right here some good solid pressure to stimulate the colon. Good elimination is very important, the elimination of toxins and waste. All point to improved and enhanced capacity for health. And because Amber had a little bit of pain up in her shoulder before, I'm going to apply some pressure right in here. Now once again, the pressure should meet the resistance of the tissue. It might hurt or be a little uncomfortable, just slightly, but it'll also feel good. That's the point at which you want to hold. Now, many times people with poor kidney function have swollen ankles. And with a very light touch, almost imperceptible, if the ankle is swollen, you can do a stroking massage in the direction of the heart. There's an extensive process of delivery of a lymph drain massage, which we can go into next time. But this will get you on the road. And the same thing on the side of the ankle, very gently and around the ankle, using your thumb. The lymph massage, next to energy, pure energy healing, is the lightest touch in all of the traditions. All of the small lymphatics are just below the surface. And then we can very gently move on to the next foot. I encourage all of the patients with whom I work to do this for themselves every day. And you can choose a nice oil if you like. You don't need to use oil, but if you like a nice almond oil. Okay. Now ready to finish this treatment.
Return to upper body.
We have released energy from the top of the body, connected to the center part of the body. We've then released all of the stagnation in the feet and sent it up, back up with the flow, up to the brain. And now we're ready to do a very soothing, balancing brain treatment. So I'm going to once again cradle the head to reestablish close contact. And because she had such a good response energetically to the stimulation of the ear points, I'd like to do a little bit more of that and take you a little bit further. And the first point that we stimulated was right in here, right at the lobe. We can move up the ear, applying quick, deep pressure. You can see the blood flow. These points contain, the ears contain hundreds of acupuncture points that we're now stimulating. And you can see I'm very gently pulling on the ear. This is highly stimulating and highly stimulating to immune function. And as I'm pulling, I'm stretching a little bit. This opens up the ear canal and also releases any tension in the jaw. And as you know, many people who are very tense will grit their teeth or tense their jaw. And this is one way to help it release. And you can spend, a good 5 minutes stimulating these ear points, and it's clearly something you can do for yourself. And the points that are the most tender are clearly the points where there's most resistance, and keep your hands on those points and stimulate those points. Now the final connection that I'm going to make is a symmetrical hold that balances the right and left hemispheres of the brain. The small finger sits right behind the ear, and then I place each finger successively so that my thumbs meet up at the top of the crown. And here is where we then enter into silence and a deep prayerful state. And in the final connection, I will balance out the physical body with the spirit body. And with a sensitive receiver, she will feel the energy. Her energy field is much expanded now and filled out. And we'll give one last bit of energy to the pancreas to help her function perfectly.